good morning.
Hi, good morning.
My name is Maria and I'm a student nurse at Laredo College. I'll be doing a abdominal assessment today. Is that okay?
Yes.
Okay. Can we start by you verifying your name and your date of birth for me, please?
My name is Rihanna Cantu, May 29, 1998.
Okay. And so, Rihanna, are you experiencing any type of pain or maybe even nausea, vomiting, constipation, diarrhea? Anything
No,
of that sort?
I'm okay.
You're okay? And when was the last time you had a bowel movement?
Yesterday in the afternoon.
Okay. And how about urinating? Is everything okay? Do you have any pain or maybe even discharge, anything like that?
No, I'm okay.
Okay. Do you remember the last day of your menstrual period?
September the 2nd.
Okay. Now I'm gonna start the abdominal assessment. To begin, we position our patient in order to expect for contour, symmetry, and surface motion to access any masses, bulging, or distension on the abdomen. To auscultate bowel sounds, listen with the diaphragm of the stethoscope. Start in the right lower quadrant and work your way clockwise. Access each quadrant for about 5 to 20 seconds. If no sounds are heard, then hear for a full 5 minutes. The sounds can be rated as normal, hyperactive, or hypoactive. Remember to properly disinfect your stethoscope diaphragm after coming in contact with a patient. Begin the systemic palpation for each quadrant and access for distension, tenderness, and masses. Begin by lightly palpating on the right lower quadrant and working your way clockwise. Make sure to advise the patient if there is any type of pain for her to let you know. To access rebound tenderness and bladder distension, begin by deeply palpating in the abdominal area. We'll begin the neurology exam. What this is I'll be basically asking you a few questions, followed by asking you to perform some demonstrations for me.
Okay.
Okay, so I'm going to begin with the first question, which is going to be, do you remember what my name was?
Maria.
Okay, and do you know where you are?
At the hospital.
Okay, do you remember why?
The physical.
Okay, and do you know today's date?
September 30, 2020.
Okay, perfect. And now, I want to know a little bit about your history. Do you have any type of maybe numbness of any part of the body, or dizziness, headaches, vertigo, or maybe changes in any of the five senses that include vision, hearing, touch, smell, or taste?
No, everything is fine.
Okay. Use the Perla system to check pupil size, shape, and equality, and the constriction of the pupil towards the light. Okay, so now we will continue by doing the muscle skeletal assessment. So first I'll start off by asking, is there any family history of joint disease or any swelling of the joints, any dizziness, weakness, maybe even arthritis or pain of any type that you've been feeling on your joints or muscles?
None.
None? Okay. Position the patient in the gait position and ask her to walk 5 steps forward and 5 steps back by placing one foot in front of the other. This will help us determine the balance. Position the patient in order to palpate the muscles. This will help us assess for redness, tenderness, resistance, or pressure or swelling. Next, position the patient and assess passive range of motion for upper and the lower extremities. This will examine flexion and extension. This can be done by examining the fingers, the wrists, the elbows, the shoulders, the back, the hip, the knees, and the ankles. In order to test muscle strength of the upper and the lower extremities for the patient, we will add resistance and the patient will have to push against us, or maybe even by squeezing our hands. That can show us that they have a nice grip. Remember to properly remove the gloves and dispose of them, followed by appropriate hand hygiene. And if the patient had bed rails, I would make sure they were up and the bed to the lowest position and let her know about the call light within reach.